Type 1 diabetes is a serious lifelong disease that tends to start in childhood. It happens when our bodies cannot produce a hormone called insulin on its own. This affects the way our bodies manage the sugar levels in our blood. Having this condition means that when sugar levels in your blood are high, like after you've had a meal, your body has no way of bringing blood sugars down to a healthy range. When blood sugars are high for a long time, it can cause serious damage to the heart, blood vessels, kidneys and eyes. If blood sugars become too high, it can be very dangerous, and people with diabetes can feel very thirsty, dizzy and confused. This is known as hyperglycemia, and if they are not treated, they may pass out and need to go to hospital. Despite this, with the right treatment regime, people with diabetes can do anything. In order to stop blood sugars becoming too high, people with diabetes have to take insulin as a medication multiple times every day and monitor their blood sugar levels constantly. The way different people take insulin and their sugar monitors may look very different. Some people may use a flash monitor to monitor their blood glucose levels. This involves pricking their finger with a small needle in order to test a little bit of blood. Others will wear a small patch on their arm that sits in their skin and continuously monitors their blood sugar levels. Some people may inject their insulin into their leg or tummy with a needle, and others may have an insulin pump, where a small machine pumps insulin into their body throughout the day, and the levels can be controlled with a small machine that is attached. Although individuals with type 1 diabetes may have this extra equipment, it should not be seen as a barrier to taking part in sport. Insulin treatment is very helpful and has allowed diabetics to live as close to normal a life as possible. However, there is a risk of hypoglycemia if the balance of insulin and sugar is mismatched. This happens when the blood glucose levels become too low, either because they have taken too much insulin on board or they haven't taken enough sugar. When this happens, the person will start feeling shaky, tired, anxious, hungry, and if untreated, they may become unconscious or have a seizure. If this happens, it's important that hypos are treated quickly. This is done by taking in 15 to 20 grams of a fast-acting carbohydrate. This could be 3 dextrose tablets, a small glass of full-fat sugary juice, or a handful of sugary sweets like jelly beans. If someone you know has a severe hypo and they become unconscious, it is important that they are put in the recovery position and an ambulance is called immediately. Never administer insulin by yourself. Diabetes can be a lot of hard work, and having to always check blood sugar levels and plan your individual insulin dose every day is tough. There is no day off from diabetes. However, with an extra bit of work, if their diabetes is well controlled, there is no reason why they can't do anything that a non-diabetic can do. People with type 1 diabetes should actually be encouraged to take part in sport and exercise, as it is good for their heart, mental health, and can reduce the need for as much insulin every day. This is on top of all the other benefits of taking part in sport, which include friendship, community, and an improved general wellness. Some may even be capable of performing at the most elite levels of sport. Famous athletes with diabetes include Olympic rower Sir Steve Redgrave and Scottish footballer Scott Allan. Due to the complexity of diabetes, there are a few things that coaches, parents and friends can show to make taking part in physical activity easier. These include understanding. It is important that people with diabetes feel that the severity of their disease is understood. but also that exercise is hugely beneficial for their condition. It is also important that it is understood that their disease is manageable with the right support. This support may be having a bag for them nearby with their supplies. That means that in the case of an emergency, glucose, insulin and glucagon are nearby. Additionally, it is important that you treat your athlete with patience. Athletes with type 1 diabetes are capable of great things. However, like everyone else, their health comes first. This means that they may not be able to manage spontaneous sessions or changes to training on the day. Blood sugars can be unpredictable and exhausting, and a little bit of patience goes a long way. Trust. It is important that you trust your athlete is doing the best for themselves. Just because you have coached one athlete with type 1 diabetes does not mean that you know how to manage everyone. It is important that your athlete knows that you trust that they are doing their best. Finally, communication. Ultimately, it is important that you have an open and clear relationship with your athlete. If they feel that they can talk to you freely about what they need, they are far more likely to keep participating in sport. Demonstrating all of these characteristics will ultimately provide a safe and enjoyable environment for people with diabetes to participate in physical activity and achieve in sport. For more information about diabetes and what you can do to help out an athlete who has diabetes, please visit the NHS website and Diabetes UK. This video was created with the support of Hampden Sports Clinic and the University of Glasgow in partnership with Lachlan's Legacy. Thank you for listening.